Good afternoon. This is our March webinar, and I'm going to be talking today about vision, behavior, and attention. And so today we're going to spend a lot of time talking about behaviors that are related to visual problems, specifically those associated with attention deficit and hyperactive disorder. Why are we talking about this? Well, children diagnosed with ADHD are 3 times more likely to have a vision problem that can interfere with attention and learning. And we're going to talk a little bit more about why that is and some of the symptoms that we see with vision problems that can affect attention. So some common symptoms of attention deficit disorder that we see that could also be related to vision problems include completing assignments at home or work, and avoidance of tasks that involve reading or close work, failure to give attention to detail or making careless mistakes in schoolwork or homework, and kids with vision and learning problems tend to have difficulty or appear inattentive and distracted during reading and close work. So this generally will affect their performance in school. And they might have trouble sitting still or squirm in their seat, especially when they're trying to do near or close work. And they'll have a tendency to not rely on vision for getting their information. So what does it mean to have good vision? So we're going to talk about what vision problems are. It's important that we are all on the same page about what we're talking about when we talk about visual vision and visual skills. So most people, when they think about what it means to have good vision, will actually think about 20/20 vision, right? What you can see on the eye chart. And that's one aspect of vision that's important for attention, because if you can't see the board or can't see things well, that's going to make it more difficult for you. So it is an important part. A lot of kids will get a screening to see if they have 20/20 vision, either at school or in the pediatrician's office, or perhaps even the eye doctor's office. But it doesn't always tell us everything about what's going on. So when we look at what 20/20 vision means, it means that when you're 20 feet away, you can see a certain size letter. So the first 20 in 20/20 has to do with the distance that you are from the eye chart. So generally 20 feet or some representation of that. And the bottom, or the second 20, has to do with the size of the letter that you're looking at. So up at the top of the eye chart is usually a big letter E. That's usually 2200 or 2400. As you go down the eye chart, things get smaller. So right above that red line is generally the 20/20 line. The green line is 20/40, which most states require at least 20/40 vision where you can drive without glasses. So first of all, one of the things important to realize is that 20/20 vision has to do with the distance measurement, and it's measuring basically, like I said, eyesight. Those numbers have been converted to at near, and that information can be helpful too to see what their eyesight is at near. But a lot of times, a lot of screens, they don't do a lot of near point testing, so they're only really looking at what's going on far away. The problem with that is that a lot of what kids are doing these days aren't far away. It's actually up close, and a lot of learning occurs within arm's length. And kids can compensate for what we call refractive errors or nearsighted, farsighted, or astigmatism by squinting or even cheating on the test. And they can still achieve 20/20 visual acuity. So it's important, though, to understand, again, these are things that are happening. This is a test of distance. It doesn't test how things are going up close. And it's not a very good indicator of academic success. So what visual skills are important for attention? Well, typically what we look at are more what we call functional visual skills. So that's the ability to coordinate the eyes, eye teaming, focusing and tracking, we'll be talking more about those. And then visual perception, or understanding and interpreting and integrating what we see. So eye teaming is basically the ability to create a single picture. So you have two eyes, and each eye has its own image, and they both have to be looking in the same place at the same time in order to get a clear and single picture. When we look far away, the eyes pretty much look parallel to each other. When we look up close, they can what we call converge on each other, right? To look at something at near. Good eye teaming skills gives us depth perception and helps us with eye-hand coordination. Helps us tell us more about where we are in space. So when we have a large eye teaming problem, or a large eye turn that you could actually see when you look at someone, that's going to create images that probably don't overlap. So something like this. So you might get two images, but they probably aren't going to overlap. So that's going to be a little bit less confusing, maybe not a little bit more confusing in other aspects of life. But what often happens is that the brain doesn't like seeing two. It's kind of confusing. So the brain tends to choose one eye to look with, and maybe will ignore the other image. Over time, if you continue ignoring that image, then you can develop what's called amblyopia, or also sometimes called lazy eye, where you actually don't have good visual acuity out of that eye. Large eye turns often disrupt what we call depth perception, or the ability to see in good three-dimensional aspects. And that's important because depth perception is a large part of how we understand where we are in space in relation to other people, other objects. And that's important for the development of other fine and gross motor skills as well. Small eye teaming problems can cause more symptoms. And why is that? Well, because when you have a small eye teaming problem, then the two images are more overlapping, and there's more of a desire for the brain to try to work to get those things to be clear and single. So this is what it could look like if you're having a small, what we call convergence problem, or inability to converge both eyes together. And so this is another example. Sometimes it can even look like things crowd together. Like you can't tell where one word ends and one word begins. As you can imagine, that could be very frustrating to look at and interfere with the ability to maintain your attention on the page. Eye focusing skills can also interfere with being able to keep your attention on the page. So what do I mean by focusing? I'm not talking about just that brain attention there. I'm talking about the ability for the eye to actually focus and clear things. So when you look far away, there's muscles inside the eye that control the lens that relax so that you can see clearly far away. When you look up close, those muscles have to do some work to be able to clear things up close. Now in a child, that process should be easy and automatic. You should be able to go back and forth from near to far rather quickly, and you should be able to sustain that focus for a long period of time without getting any visual fatigue. Usually around age 40, adults start having a lot more problems with this area, not because the muscles stop working, but usually because the lens itself gets harder to move, and that's why adults go to reading glasses and bifocals, usually sometime after age 40. Poor focusing skills, so if you can't keep your things clear up close, then you're going to have some trouble with a little bit of blurry vision. Now, another thing that we sometimes see is that they might work really hard, get things clear up close, and then when they go to look far away, that focusing system gets kind of stuck and it spasms a little bit, and that'll actually interfere with their distance vision. So they might say that sometimes their distance vision is blurry. They get a traditional eye exam, everything checks out, but that's because that doctor may not have checked what's going on up close to see that there's actually a focusing, or the medical term, accommodative problem going on. So it's pretty easy to understand that there could be some physical symptoms related to these poor visual skills, double or blurred vision, eye strain, fatigue and headaches, eye rubbing or excessive blinking. Some patients complain that the words might move around or wiggle. A lot of times you might see that them try to compensate for these problems by covering one eye or tilting the head, or maybe even bringing the page closer to them, and that helps them basically look with one eye, or might move the other image out of the way. But for those that are struggling, a lot of times they might not see physical symptoms because they avoid, because it's hard to look at, they don't want to look at it, and so they tend to have poor attention, especially to that near work with reading, and then it starts to look like attention deficit disorder, especially that inattention type of ADD. It also, of course, will interfere with their ability to fluently read, and they might have more difficulty with comprehension because of these eye teaming and focusing skills. The other thing that can interfere with reading fluency is eye movement and tracking skills. So when I talk about tracking skills, I'm talking about the ability to accurately track and follow with the eyes. CITTs are the type of eye movement skill related to moving the eyes from one point to another, and pursuits are the ability to follow a moving object. CITTs are probably the most important for reading, and pursuits tend to be more important for sports. I'm going to play this little video here that's going to kind of show you what's going on with someone with that has nice eye movement skills and someone who doesn't have very good eye movement skills. So this little black bar that you're seeing moving across it's actually looking at the eye tracking. So there's a pair of goggles, we have this in our office, that they wear while they're reading a paragraph, usually based on their age, and it tracks what the eyes are doing. So replay that. What you can see is that the eye movement recording on the right looks very smooth. The eyes are moving across the page, left to right. When they get to the end of the line, they accurately move to the next line. In the paragraph on the left, what you see is someone with very poor eye movement skills where the eyes are jumping around. So this person's likely losing their place a lot, and that's really going to interfere with the comprehension and the reading fluency. And of course, anyone who knows anything about sports, one of the main things that coaches say, what do they say? They say, keep your eyes on the ball. Well, in order to keep your eyes on the ball, you have to have good eye tracking and eye movement ability. Otherwise, it's going to be very difficult to maintain that eye contact on the ball, and then you start to see some difficulties with the eye-hand coordination. So not every person has difficulties in both areas. I see kids who are pretty good athletes that have very good pursuits, but have a lot more difficulty in the area of the saccades when it comes to reading, or maybe their eye tracking up close just isn't as good as it is far away. So part two of once we get the input in, which is what we've kind of been talking about with those first visual skills, including the teaming and the focusing and tracking, that's all about how we get the information and how efficiently we get the information in. Part two of that is the ability to process visual information. So that would be interpreting and remembering what we see. So some of the areas that we look at for that include visual directional skills, which include the ability to understand right and lefts, and that's important for letter reversals, If you think about it, the B's and the D's are the same except for their orientation. So if you don't really understand or have a good sense of direction, you're going to reverse things much more often. Visual discrimination is the ability to pick up the details and to be able to see the details. Of course, if you have poor input skills, that visual discrimination part of visual processing is going to be much less developed. Visual figure ground is being able to pick out the relevant information. So when you've got a lot of things going on, being able to pick out what you're looking for. Visualization is a huge and very important visual processing skill that affects everything from speech to memory to reading and comprehension. So visualization is that ability to picture things in your head. That includes including that things like visual memory, visual sequential memory, which is just remembering things in a sequence, and visual closure, which is being able to kind of like fill in the gaps. So if you have an incomplete picture, being able to understand how everything fits together. So one of the reasons why we see some vision problems with attention is that when vision is working well, it leads, and when it's not, it interferes. And that's a quote by one of my mentors, Dr. John Struff. When a child does not trust his vision, he's less likely to use that sense to gain information. And that can cause difficulty. So if you don't use or don't make vision the leader because maybe you don't trust what you're seeing because it doesn't give you good information, then you might rely on touching things to get that information. So kids who are very tactile or very hands-on may be having some trouble with their visual system. You'll also have more difficulty visualizing verbal directions or concepts. So again, it goes to that visualizing piece that has to do with understanding directions and multi-step directions. If you can visualize what the person is saying, you're much more likely to comprehend what they're saying and be better able to follow through with those directions. And of course, it can definitely cause difficulty maintaining visual attention for the reasons we talked about earlier. And something we don't often think about when it comes to vision, but vision is part of a bigger overall process of understanding where we are in space or in relation to things. So when we talk about the ability to maintain personal space, that really does come from the visual system. And picking up on social cues also comes through the information we get from the visual system. So inability to maintain eye contact sometimes can be related to an inability to use both eyes together. I've heard that a lot from adults who are having trouble with their visual system and keeping things single, that they also have trouble with eye contact. A lot of times they can't maintain eye contact and listen at the same time because the vision is kind of then becomes distracting. So when we see problems with these visual skills, we can see where that can lead to other behavior problems, especially frustration and behavioral issues, especially related to the schoolwork. And so when you start to look at these symptoms within completing assignments and homework and avoidance and poor attention to detail, inattention, and overall worried about the school, your child's school performance, one thing you should think about is, could vision be contributing, if not the main cause of this? And so the study that I talked about where children with ADHD were more likely to have a vision problem was this NIH vision study that looked at children with the most common vision problem that I treat, which is called convergence deficiency. And they found that kids labeled with ADHD were 3 times more likely to have difficulty with convergence insufficiency. That same study also showed that treating the convergence insufficiency resulted in significant improvement in those academic behaviors. How common is this? Well, maybe more common than you think. So different children might manifest their problems in different ways. Not everyone has the inattention type. Sometimes they do get headaches or eye strain, but overall vision problems that have the potential to affect learning occur in 1 out of every 4 to 5 children. And that number goes way up in kids with other special needs or having other issues, especially fine and gross motor problems. Overall, convergence insufficiency, like I said, that's the most common condition that I treat. It occurs in about 17% of the population. So then, what should you do if you suspect that a vision and learning problem might be present? So there's a little bit of confusion about the different kind of specialists. A lot of times you might think, well, the school has a vision specialist or vision teachers that could help, but those specialists are really specialized in low vision, which has to do with maybe there's a structural problem with the eyes or the brain that prevents them from seeing 20/20. So that goes back to the eyesight. They have very little training in the areas of eye teaming and tracking and focusing that I'm talking about. Opticians are the ones that sell the glasses, so they're not going to be the ones that are going to help with this problem. And ophthalmologists are eye surgeons and treat disease, so they don't get as much training in the functional vision problems or how to test. A lot of times they don't do the extra testing needed. And optometrists are basically your primary care eye doctors. So think of like ophthalmologists are the surgeons, like an oral surgeon. Optometrists equivalent to that would be like the dentist, okay? Optometrists do get, in every optometry school, do get some training in the areas that I talked about, but many don't specialize in it or have do the testing necessary to identify the problem. So really what you're going to look for is someone who has training in neurodevelopmental and behavioral optometry, because those are the doctors that specialize in these type of vision problems. So typically those doctors are board certified and have the letters FCOVD after their name. And that just tells you that they have gone through certification process and they have special training in the area of functional vision, vision therapy, and neurooptometric rehabilitation. So that's, if you're looking for a doctor, that would be one way to know if they have special training in this area. So what is optometric vision therapy? Well, it's an individualized program. It progresses as the patient progresses, and it's designed to remediate and enhance visual skills and visual information processing. What separates optometric vision therapy from maybe what an occupational therapist might work on for eye movement skills is our use of lenses. It is very difficult, in fact, to work on eye focusing skills and eye teaming skills without using a lens to help facilitate that process. So I would say 80% of the therapy is done with some sort of lens in front of the eye. And speaking of occupational therapists, I do think they have a key role in treating patients who have especially significant difficulty with the hyperactive and impulsive component of ADHD. A lot of times what we'll see is those patients also have deficits in this overall spatial and body awareness, maybe because they're proprioceptive, or the system that tells us about our joints and where we are in space are also having problems, as well as the vestibular system, which is our inner ear and balance system. So vestibular, proprioceptive, and vision all tend to work together. Sometimes kids will have deficits in all 3 areas. In that case, I think the combination of vision therapy and occupational therapy can be really effective in treating those problems. Other patients may also have had some sort of brain injury or deficits in what we call executive function. that's a different area of the brain. Although vision is related, sometimes there are some other areas that affect attention that aren't quite just vision. And a lot of times a combined approach, again, of vision therapy and occupational therapy can be helpful in improving those skills. And then don't rule out other things that affect just the overall brain. I talk about sometimes brain fog that can occur with a poor diet, or if there's food sensitivities going on. Dairy and wheat probably being some of the most common examples of food sensitivities. Not getting adequate sleep or having some kind of disease such as sleep apnea. Allergies, chronic ear and sinus problems can all contribute to difficulties with the attention as well. So it's important to look at this process as an overall process. And if those things are an issue, to also work on treating those. So I want to thank you for your time. And then if you would like more information, you can visit our website. We also have a Facebook page with lots of good information. You can also check out covd.org and optometrist.org for more information. Please let us know. You can contact us at info@newhorizonsvisiontherapy.com or by phone 608-849-4040. Thanks.